Hi, everyone. Thank you for joining us for our CareConnect convo today. We are super excited to have Dr. Michelle Udayamurthy with us. She is a internal medicine physician here at Kelsey-Seybold, and she practices at our main campus just west of the medical center. We're going to go ahead and get started in just a few minutes. We'll give everybody a chance to log on. While we're waiting for everyone to log on, we just want to go through a few housekeeping things with you today. Your cameras and microphones are muted, but if you have any questions, we definitely want you to ask them through our chat feature or the Q&A feature, which you can see at the bottom of your Zoom screen. I'll be monitoring those through our time today with Dr. Udayamurthy, and we'll do our best to get all of your questions answered. So I think we'll go ahead and get started just because we only have 30 minutes with her today, and I know we have a lot to cover. So Dr. Udayamurthy, welcome, and thank you so much for joining us for a CareConnect convo.
Thanks, Lane. Happy to be here.
So tell us a little bit about your practice at Kelsey-Seybold and your background as an internal medicine physician.
So I've been at Kelsey-Seybold for a couple of years now, and I practice internal medicine, which is 18 and older, and I'm a primary care physician. So basically like your family doctor that you go to for all your preventative care and sick care needs.
What demographic of patients do you serve? Do you see babies through adults, or is there a certain age range that you see?
So typically 18 and up. So 18 all the way. I think my oldest patient right now is 103 years old. So
Wow. Okay, well, we're going to go ahead and start it. So thank you again to everyone who joined us. We're going to jump right in and talk about boosting your immune system. There's a lot of stuff going around right now. We know it's allergy, cold, flu, COVID season. So this is a whole new combo, I know, for our providers at Kelsey as well as our patients. So let's talk about what we can do to boost our immune system to kind of keep some of those germs away. What are some of the things we can do when it comes to healthy eating? Are there certain foods or drinks that sort of give you a boost?
So healthy eating to boost your immune system starts with eating a well-balanced diet. So plenty of fruits and vegetables, lean proteins, eating like less processed food, less sugary food. Those all go a long way in boosting your immune system. The other thing is you can also eat foods that are high in antioxidants. So things like blueberries and any berry, actually, to be quite honest, those all have really high amounts of antioxidants, which actually help boost your immune system as well.
What about vitamin C? There's a lot floating around on social media about taking vitamin C supplements. Is that something that you advise your patients?
So no, typically I don't recommend taking a vitamin C supplement. Most people in their normal diet get enough vitamin C per day. If you feel like you're getting less than enough vitamin C per day, eating like oranges or tomatoes or most fruits and vegetables, that'll get you enough vitamin C per day. Sometimes if you eat too or take in too much vitamin C, that can cause some bad side effects. So typically, I think getting it a little bit naturally, that's a lot better than taking the supplement.
If you are taking a supplement, how much is too much to take?
So I think usually if it's in a regular vitamin, a multivitamin, that's okay. But anything on top of that, I wouldn't take.
Since you mentioned multivitamins, is there a specific, if you're looking to boost your immunity, are there specific ingredients you should be looking for in a multivitamin that would help boost immunity? Or is it kind of all multivitamins are created equal?
So yes, that's a really good question. Most multivitamins are pretty equal. The only again, most people's diets get enough of the vitamins and minerals that we need on a daily basis. Taking a daily multivitamin usually is not harmful, and it can be helpful too. But there's not a specific like formulation or a specific brand that I would say I would go for. I think the biggest thing in supplements, and this doesn't necessarily have to do with the immune system, but the biggest thing with supplements is probably taking a calcium tablet and a vitamin D supplement every day, because we don't usually get that much vitamin D since we mostly stay inside. And that's really good to add per helping bone health and helping like muscle health, which is important as we age.
So let's talk a little bit about supplements as you age then. Vitamin D and calcium, should you take anything else if you're aging?
So those two are the main ones. Vitamin D typically is about like 2,000 units per day. Calcium is like 500 milligrams per day. And you can get most of these in a combination tablet at your local like pharmacy or where you get your medications. And just getting the generic brand is probably like the best and the cheapest. Those are the two supplements I would say for sure take.
So let's talk a little bit about sleep. As a mom, I'm for sure sleep deprived still, even though my kids are getting a little older. But what impact does sleep have on your immune system?
So sleep plays a big role with your immunity. I'm sure everybody has experienced this. When you get multiple nights of less sleep or not good quality sleep, you end up falling sick. And that's because you're just feeling so run down. You don't have time to recover. Sleep is a very like restorative recovering process that we all need every day. So getting a good amount of sleep is actually really important. And that can vary per person. Usually, typically, we like to say 7 to 8 hours, but that could be more or maybe a tiny bit less depending on each person.
And what about, you talked about getting colds, and I know we've mentioned vitamins and supplements. Is it true that zinc can help fight off cold symptoms if you take it when you feel the onset of symptoms?
So I don't have any medical proof of that. So no, I think the best thing to do when you start feeling cold-like symptoms is now for sure stay home. And then the second thing is hydrate as much as you can. And the third thing is actually get as much rest as you can too. Those things will actually help you recover a lot faster.
We have a question that came in about calcium. If you cannot eat any milk-based products, what are alternatives to get calcium through your diet by eating versus taking a supplement?
So that is a great question. I think mainly calcium is found in most like dairy products. Um, so it's kind of hard if you're not eating a lot of dairy. Most people that can't eat dairy, you can actually eat a little bit of yogurt because that has good probiotics and it doesn't digest as easily as, or it digests easier than dairy, other dairy products. But probably the best recommendation is if you can't do a lot of dairy, probably taking a supplement is probably the best choice.
So let's talk about cold, flu, allergies, and COVID. How do you tell the difference between just your standard cold and allergies? For example, like seasonal allergies.
Okay, so sorry, my phone cut out for a second. So seasonal allergies, you're typically going to have the symptoms that are like itchy eyes, watery eyes, maybe having a little tickle in your throat with a slight cough, sneezing, maybe some mild congestion. You're not going to have like shortness of breath or fever. So those like that allergy-like symptom is pretty mild. If you have a cold, you might have a little bit of mild sore throat. You may get a fever, but that's pretty rare. You could have congestion, a little bit of cough. You should typically not have shortness of breath, and typically not really have like body aches or, nausea, vomiting, any GI symptoms. So COVID, that one is a little bit more extreme with the symptoms. It would be like body aches, shortness of breath or trouble breathing, cough. You typically do see fever, and you can also see some GI symptoms like nausea, vomiting, or diarrhea. And then the biggest thing, the telltale sign of COVID right now that we're seeing is loss of sense of taste or smell. If you have that, then you definitely need to be tested for COVID because that's a high likelihood at that point.
And what about the flu? Um, we also want to put out a little PSA here. If you have not received your flu shot yet, I know Dr. Udayamurthy will probably say it, but definitely get your flu shot this year. If you're a Kelsey patient, it's super easy to do. If you're not a Kelsey patient and you need a flu shot, we can still help you with that as well. So Dr. Udayamurthy, do you want to talk about the importance of getting your flu shot this year and sort of what symptoms are similar between flu and COVID?
So I do think it's a great idea, like you said, Lane, to get your flu shot this year. I think the flu is one thing we can prevent. So getting your flu shot is super important because we should just eliminate the flu as a factor this year if we can. And for people, you can get a flu shot starting at 6 months all the way up. People over 65, we recommend the high dose flu shot, which again, you can get at any Kelsey clinic as well. To tell the difference between the flu and COVID, it's a fine line and it's kind of hard. So the flu, typically we have cough, fever, maybe some sore throat, some body aches. Typically we don't have shortness of breath with that. And the fever usually is like pretty instantaneous and it only lasts like 2 or 3 days at the most. For COVID, you have similar symptoms, but again, the breathing symptoms will be a little bit worse. And then the other thing that would be there would be the fever lasts generally a little bit longer with COVID.
We're going to stick on the topic of COVID for just a second, and then we're going to shift back to immunity. But if you look on, social media or news outlets, we're seeing lots of stories and headlines about COVID cases rising in the Northeast. Are we still expecting another wave of COVID-19 in the fall here in the Houston area, or like fall or winter?
Unfortunately, yes, we are expecting another COVID spike or third wave, as we call it, in the fall or winter. We're actually closely approaching that point right now. The biggest way to lessen that impact of the wave is wearing a mask and definitely social distancing and just being really conscious of washing your hands and doing good hygiene in general.
So let's pop back to boosting your immunity. Are there things simple tips we can incorporate in our everyday life for boosting our immunity? You mentioned a lot of us are inside most of the day working in offices or maybe inside at home. Do you have any quick tips for things you can do? Maybe, get out and go for a walk or, open your windows to get fresh air. Are there any lifestyle tips to incorporate?
Yeah, exactly what you said, like doing some exercise every day, even if it's a short amount, like a 15-minute walk, that's a great way to boost your immunity. Making sure you reach for better wholesome food choices, especially heavy on the vegetables and fruits. That's a great way of boosting your immunity. We also talked about getting enough sleep and quality sleep. That also helps boost your immunity. And then the other thing is actually trying to reduce the stress in your life, because that also boosts the immunity. And I know that's kind of hard right now, but taking a few moments each day to kind of clear your mind or recenter yourself, that can go a long way.
We have a question that came in about food. Will organic food boost your immunity more than conventionally grown produce?
So that's a really great question. I don't have a medical answer for that. I do think organic food is a little bit better because it has less chemicals involved. So if that is something that you can afford and can have access to, I'd say pick the organic food instead. Especially I think when it comes to meat, doing organic meat is definitely a better choice than regular meat, if possible.
Another question that came in was, what is your favorite lean protein to eat and how much lean protein should we be eating every day?
So my favorite lean protein to eat is probably chicken. I really like chicken a lot. We cook it at home. Like we do chicken in every form, like ground chicken, chicken breast, chicken sausage. Usually you want like 2 to 3 servings of lean protein per day. That will get your protein intake pretty well checked off.
Okay, let's see. I'm scrolling down through some of these now. We have a question that came in about sleep. How much sleep is too much sleep?
So that's also a good question. You don't want to wake up from going to sleep feeling like even more groggy or tired because you got too much sleep. So typically on an average adult, you need only 7 to 8 hours of sleep per night. Some people do require more and some people do require less. It just depends on how you're feeling. You want to feel pretty refreshed when you wake up, not like groggy or, wanting to go back to sleep.
Perfect. Let's see. I know we only have a few more minutes with you before you have to get back with patients. So we'll get our last few questions answered today. Let's see. Oh, here's a really good one. Why did you decide to become an internal medicine physician?
So I really like seeing patients in clinic. That's like one of my favorite things. I like getting to know patients over a long period of time, which definitely internal medicine lets you do, which is awesome. And I think the other thing is, treating the whole body, knowing a little bit about every body organ system, that's pretty fun too. So those are all the reasons why I chose internal medicine.
Let's see, questions are still coming in. So we have a question about back to antioxidants. If you can't eat berries due to other health issues, what alternatives do you have for making sure you're getting enough antioxidants?
That's a great question. So mangoes have a lot of antioxidants in it. Some nuts have a lot of antioxidants, like almonds and I think walnuts. And then even some lean proteins like salmon, that has some antioxidants in it as well.
Salmon is a favorite in our house. We cook that a few times a week. So many different ways. It's pretty versatile. And we repurpose it on salads for lunch and different things like that. So I think maybe if people are struggling with, how do you eat lean foods and kind of lean proteins, we cook just kind of, a big piece of salmon and we repurpose it in different meals through the week. It helps conserve energy in the house and my time with cooking. And it's really easy just to throw on a salad with some, like sliced almonds, some ginger soy dressing, and it's delicious and easy. So if you're a big fan of salmon, definitely suggest trying it with lunch on a salad too if you haven't.
I think that's a great idea.
We're going to take 2 more questions and then we're going to start winding down our time with Dr. Udayamurthy today. There's your lunch break as well too, so we want to make sure that you have some time to eat before you have to see patients again. So the flu shot, what is the difference between the flu shot and the flu mist?
So the flu mist is actually a live virus flu shot. So the people that can get it, the group of people that can get it is a little bit more limited. The flu mist is just as effective as the flu shot, I would say, for people who are very averse to needles. And if you fit in that age range, I believe it's like from 6 years to 40 years old. And then you can't have like any respiratory conditions or anything like that. That qualifies you for the flu mist. But if you're a little like scared or, anxious about getting a needle stuck, then I would definitely go for the flu mist because that still keeps you covered against the flu this year.
Another question came in about vaccines. Are there any other vaccines we need to get this fall besides the flu shot?
So if you are over 65, you should definitely make sure your pneumonia vaccines are up to date. That's another easily preventable respiratory disease that we can avoid this year. If you are under 65 and you have certain health conditions like asthma, diabetes, kidney disease, then you probably do qualify for a pneumonia vaccine and you should definitely get that done. The best way to figure that out is just speak with your doctor.
Perfect. Well, we're going to go ahead and wrap up our time today with you. So thank you so much for joining us. And everyone who tuned in, Thank you for joining us for our CareConnect Convo today. We will be posting this on our social media pages later. So if you want to rewatch it or share it with anyone, please feel free to do that. Again, Dr. Udayamurthy, thank you for joining us, and everyone else who joined us. We're going to continue our bi-weekly CareConnect Convo. So every other Wednesday at 11:30 a.m., you can tune in. You can register at our Kelsey-Seybold website. On the top right section, there's a little link that says about. You can click on that, go to events, and see what we have coming up to RSVP from there. So have a great afternoon, everyone, and thank you again for joining us. If you do need to get your flu shot, you can call 713-442-0000, and our 24/7 contact center can help you get that done. So, all right, have a good afternoon. Thanks, Dr. Udayamurthy.
Bye, everybody, stay safe.